Hello and welcome to my channel. In this video we will discuss about a skin condition called melasma, or you can say chloasma. So the basic topics that we will cover in this video are, first of all, we will talk about what exactly is melasma or chloasma. The next we'll talk about what are the clinical features, that is what are the signs and symptoms of melasma. The next we'll talk about what are the basic etiologies, that is what are the causes that leads to this skin condition called melasma. The next we'll talk about diagnosis, that what are the investigations that can be made in order to know that you are suffering from melasma or you have another skin condition. And lastly we'll talk about the treatment. So these are the basic topics that we will cover in this video. So let's start. So first of all, we'll talk about what is melasma or chloasma. So a patchy brown or the dark brown skin discoloration that usually occur on the face and may result from hormonal changes as in pregnancy and during the administration of estrogen containing oral contraceptives. This is the exact meaning of melasma, and it is generally found on sun-exposed areas of the face, and melasma often fades over several months after stopping oral contraceptives and hormonal replacement therapy, that is HRT, and after delivering a child. It may return with additional pregnancies or use of these medications. The patches gradually fade over many months, and in some people, the discoloration never entirely disappears. However, this condition develops spontaneously, and in some women who are neither pregnant or not taking oral contraceptives or HRT medications. Now, next we'll talk about what are the causes, incidences, and the risk factors that lead to this condition called melasma. So let's talk about it. So melasma is very common skin disorder, though it can affect anyone. Young women with brownish skin tones are at greater risk. Melasma is especially common in aged women aged 20 to 40 years. It is more common in dark skin than in fair skin. Secondly, melasma is often associated with the female hormone estrogen and progesterone. It is especially common in the pregnant women and the women who are taking oral contraceptives and women taking HRT, that is hormone replacement therapy, during menopause. Now, third cause is sun exposure. So sun exposure is also a strong risk factor for melasma. It is particularly common in tropical climates. Next cause of melasma develops due to combination of genetics, hormonal, and sun-related factors. And next cause is melasma has been referred to as a mask of pregnancy because it often develops during pregnancy. Because of melasma's relation to the pregnancy and the oral contraceptives, it is thought that estrogen contribute to its development in the predisposed persons. Next cause. Estrogen is not essential to the development of the melasma, however, as men may also be affected. Both ultraviolet A and ultraviolet B are believed to be contributed to the formation of melasma in the predisposed person. It may develop in association with the menopause, hormonal imbalances, and ovarian disorders. Next cause. Melasma may be triggered by a medication called. It is thought that female sex hormones causes melanocytes, or the pigment producing cells, reproduce and deposit excess pigments. Chloasma is more pronounced during the summer months as a result of the sun exposure. It usually fades a few months after delivery. Repeated pregnancies, however, can intensify the pigmentation. Deficiency of the folic acid during pregnancy can lead to development of melasma, and melasma during pregnancy is relatively high. Sometimes it is called the mask of the pregnancy. The dark patches typically last until the pregnancy ends. Despite a strong connection to the hormone, no one knows exactly what causes the skin discoloration. And other factors that make it more likely that a person will get melasma include using medications that make you sensitive to the sun, that is photosensitizing. This can include some cosmetics and medicines used to treat ovarian or the thyroid problems. So if you are already susceptible to melasma, exposure to the sun increase your risk. For example, when women who are pregnant or who takes hormone medications and avoid the sun are less likely to develop melasma than are those who spend a lot of time in sun. So these are the basic causes, etiologies, and the risk factors that are responsible for the formation of melasma. Now next we'll talk about the clinical features, that is for the symptom picture of the chloasma. So let's talk about it. The symptoms that you can note are: first, tan and the dark browny patches. Secondly, irregular in shape. Thirdly, these patches usually develop on the upper cheek, upper lip, and forehead. Next, the dark patches often appear on both sides of the face in a nearly identical pattern. The darker colored patches of the skin can be of any shade, from tan to deep brown. Next, rarely these dark patches may appear on other sun-exposed areas of the body. Next, the dark patches often appear on both the sides of the face in a nearly identical pattern. The dark colored patches of the skin can be of any shade from tan to deep brown. Melasma does not cause any other symptoms besides skin discoloration, but may be of great cosmetic concern. So these are the symptoms of chloasma. Now next we'll talk about the investigation, that what are the diagnoses. So diagnosis is simple, done by skin examination. A doctor may use a special lamp called Booth's lamp that gives off ultraviolet light. It allows the doctor to see a pattern and depth of the skin discoloration more clearly. And medical history will help to determine any factor that may have caused this disorder. It was all about diagnosis. And if we talk about the treatment, then that we will discuss in next video, that is how we can treat chloasma, or you can say melasma, by using homeopathic medications, and what are the top homeopathic medicines that has been successfully used for the treatment of melasma. So for this, stay connected with us. So that's all for today. See you guys in our next video. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below, and yes, press the bell icon for more updates. Stay safe and stay healthy. And yes, thanks for watching this video.